Hi guys, my name is Bridget and I'm going to talk to you about mental disorders today. The first mental disorder that we're going to start with is anxiety disorder. Signs and symptoms of anxiety disorder include fatigue, sweating, racing thoughts or unwanted thoughts, excessive worry, fear, feeling of impending doom. So sometimes when you're about to have a big test, you may have anxiety, you feel nervous, you start sweating, and you don't know how you're going to go on the test. Yeah, you're in nursing school.
All right. The treatments consist of therapy. Treatments include counseling or medications, including antidepressants. Self-care, you want to avoid alcohol, may be harmful and aggravate certain conditions. Reduce caffeine intake. This reduces the risk of aggravating certain conditions. Physical exercise, so do aerobic activity for 20 to 30 minutes, 5 days a week. It improves cardiovascular health. If injured, pursuing an activity that avoids the injured muscle group or joint can help maintain physical function while recovering. Stress management, pursuing an enjoyable activity or verbalizing frustration to reduce stress and improve mental health. Quitting smoking tobacco, relaxation techniques, deep breathing, meditation, yoga, rhythmic exercise, and other activities that reduce symptoms of stress. A healthy diet. A healthy diet provides essential nutrients and adequate calories while avoiding excess sugar, carbohydrates, and fatty foods. Some therapies. We'll do cognitive behavioral therapy, a talk therapy focused on modifying negative thoughts, behaviors, and emotional responses associated with psychological distress. Some medications. We do SSRI, antidepressant, sedative, nerve pain medication. And that's it for the anxiety disorder.
What is schizophrenia? Schizophrenia is a disorder that affects a person's ability to think, feel, and behave clearly. Treatment can help, but this condition cannot be cured. For chronic, can last for years or long life. It requires a medical diagnosis. The exact cause of schizophrenia isn't known, but a combination of genetics, environment, and altered brain chemistry and structure may play a role. Schizophrenia is classified by thoughts or experiences that seem out of touch with reality. Disorganized speech or behavior and decreased pause it. Dang it, I messed it up.
I can't do it.
Symptoms. Symptoms requires a medical diagnosis. Schizophrenia is characterized by thoughts or experiences that seem out of touch. People may experience behavioral, social isolation, disorganized behavior, aggression, agitation, compulsive behavior, excitability, self-harm, or lack of restraints.
I'm Megan, and I'm going to tell you about some of the treatments for schizophrenia. Treatment is usually lifelong, and it often involves a combination of medication, psychotherapy, and coordinated specialty care services. Generally, some of the medications are usually antipsychotic medications. These medications reduce or improve the symptoms of certain psychiatric conditions, such as schizophrenia. Just some examples of the medications would be things like Haldol, Prolixin, Risperdal, Geodon, Seroquel, olanzapine, Thorazine, Abilify, and Compro or Clozaril. Also, a lot of these medications can cause some side effects, such as tremors or facial drawings, and a lot of times that we give medications after the antipsychotic regimen to reduce those types of side effects. Main medication given for that is going to be Cogentin. Other than medications, we do need to do some therapy sessions. You could do support groups. These types of services offer counseling and share experiences among people that have some of the same conditions that you do. You also need to do rehabilitation, and this involves kind of retraining the brain to get rid of some of those thoughts that aren't good, some of those that are maybe distorted, and we can change those thoughts into something positive. Cognitive therapy is along the same lines as rehabilitation. Usually that involves talk therapy and focusing on replacing negative or distorted thoughts with positive ones. Psychoeducation, it's important to educate people about mental illness and also serves to support, validate, and empower patients. Family therapy may also be needed. This mainly helps families with people in their family who have psychiatric disorders, and it can help to resolve conflicts and communicate more effectively for the patient and the family. Behavior therapy may also be needed, and it generally focuses on modifying harmful behaviors associated with psychological distress. Those could be things such as suicidal or homicidal ideations. Group psychotherapy involves a group of one or more people speaking together, could also collaborate with the therapist, and they discuss their problems with the particular psychiatric diagnosis and try to come up with better ways to deal with them.
My name is Brandon. This is Brenda. We're going to be talking to you about clinical depression or major depression. So sometimes a constant sense of hopelessness and despair, that's a pretty good sign of a major depression. Basically, depression, you can have, or clinical depression, that's going to be for most of the day or most of the time rather than just slight depression. So it can actually happen only once in your lifetime, or it can happen several times throughout your lifetime. So sometimes, if you feel sad or low at some point, you could be somewhat depressed, but clinical depression is happening almost constantly all the time. Symptoms usually present every day and last at least 2 weeks. And some of the other symptoms are fatigue, loss of energy, feeling of worthlessness, guilt, impaired concentration, indecisiveness, insomnia or hypersomnia, marked diminished interest or pleasure in almost all activities nearly every day. So everything that you used to want to do, go out and paint or ride a bike or whatever, you just don't want to do that anymore, including having sex. Restlessness or feeling slowed down, recurring thoughts of death or suicide, significant weight loss or gain. And there's a couple of different risk factors and a couple of different people that are at risk for depression. Major depression, people who are most at risk are basically women. Women are almost twice as likely to be diagnosed with major depression throughout their lives due to certain hormonal changes during puberty, menstruation, pregnancy, menopause. All that stuff can increase the risk of clinical depression. Men can be clinically depressed, although it does go underreported a lot of the times. Same thing with teens or young children.
All right, my name is Brenda. We're going to talk about treatment. Medications and psychotherapy are effective for most people. Your primary doctor or your psychiatrist can prescribe these medications. Many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professional. If you have severe depression, you may need a hospital stay, or you may need to participate in some outpatient treatment. Some medications are many types. Well, there's many types of antidepressants that it can be treated with, and they're available. One of them is a selective serotonin reuptake inhibitor. Doctors often start by prescribing these. These drugs are considered safer, and they're generally cause less or fewer side effects. Other types of antidepressants such as Celexa, Lexapro, Prozac, and Zoloft. All right, some example of some serotonin norepinephrine uptake inhibitors would be like Cymbalta, Effexor, Fedzima, and levomilnacipran. Some atypical antidepressants. These medications don't fit really into any of the antidepressant categories, but however, they include Wellbutrin, Wellbutrin SR, Remeron, Trazodone, and Trintellix. Some tricyclic
That should be good.
antidepressants.
I think that should be good.
You think so?
Yeah.
Okay.
Also, sometimes just talking will help out tremendously, but sometimes they'll do a mixture of either talk therapy and combination of these drugs or medications that can either make the symptoms less severe, last frequently, less frequent, or it can possibly give you an extended amount of period where you're not clinically depressed. All right, thank you.
Yes, I can't get it to pause because this popped up.
Good. My name is Lindsay, and we're doing bipolar disorder. Bipolar was previously known as manic depression. So with bipolar, you have you're extremely active and you're manic, and then you'll be really depressed and down in the dumps. And so with that, with manic, it could be up to a week. And when you're in your manic phase, people talk really fast. They're very active. They don't really eat. They actually are more sexually prone to act out. And with the depression, they're really in the dumps. They're down, and that can last up to about 3 to 6 months. And when they're in their depression, they're at an increased risk for suicide.
Ready? Okay. Some treatments for bipolar disorder consist of medications and therapy. Treatment for bipolar is usually a lifelong process and often involves a combination of medication and therapy. Some of the therapies that are effective for bipolar disorder are support groups, which is counseling and sharing experiences among other people with similar conditions and goals. There's cognitive behavioral therapy, which is talk therapy, which is focusing on modifying negative thoughts, behaviors, and emotions. There's psychoeducation, which is just education about mental health that also serves to support, validate, and empower the patients. There's family therapy, which involves counseling with families of patients to help resolve conflicts and communicate more effectively. And there's psychotherapy, which is treatment of mental or behavioral disorders through talk therapy. There's a number of medications used to treat bipolar disorder. Some anticonvulsives are used to treat it. They prevent or control seizures, relieve pain, and treat symptoms of these psychiatric disorders. Maybe Tegretol, Topamax, Lamictal. There's antipsychotic drugs that are used, such as Haldol, Risperdal, Seroquel, Zyprexa, Abilify. Also the use of SSRIs, which are selective serotonin reuptake inhibitors. They ease the symptoms of depression and anxiety. This would be like your Prozac. There is some supportive care, such as hospitalization, which is where you just need a higher level of care. This sometimes helps get patients' medications under control where they can function in a normal society. These patients are closely monitored and sometimes given medications that would not be available to them at home. There are a few specialists that will see bipolar patients. A psychiatrist is someone that would treat mental disorders mostly with medications. They also have to diagnose these disorders. A clinical psychologist treats mental disorders primarily with talk therapy. And then you can also have your primary care provider, which will help prevent, diagnose, and treat diseases as well.